Hi, I'm Dean Gomez. I'm an actor and an athlete. As an actor, I started 2004 when I was in high school. Three of my most prominent roles are one, as Dr. Jose Rizal in a stage musical, two, as Gerardo de Leon, National Artist for Film in PTV4, and three, as Ramon Gonzalez in Ang Provinciano. And as an athlete, I've been competing internationally for several years. And recently, during SEA Games, I acquired a license to become an umpire for rowing and dragon boat internationally. My main concern for my skin is the eye area. I really want to go back to commercial modeling since my last commercial was like 5 years ago. So I really need to have a bright and tight eye area so that when I smile during commercials, it's pleasing. And I really want to correct the under eye area. It's a little saggy and a little dark. How did I know about CSA? I'm new here in Pampanga, just 3 weeks, and I just Googled the name Dermatology Center nearby, and then CSA came up. And then I called, and CSA immediately answered. And I booked immediately an appointment, and the next day, I was doing a procedure here. Don't forget to click the subscribe button and the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let us all welcome Mr. Dean Gomez. Welcome, Dean.
Welcome.
It's his first time with us, joining our YouTube videos or our several episodes. Okay, so
Pleasure to be here.
yeah, Dean was here just a few days ago. And can you share with our televiewers what was our treatment?
Yeah, I was here about 4 to 5 days ago, and then I went with
Botox.
Yeah. I chose the Botulux.
Yes.
Yeah.
Botulux brand.
And then for my crow's feet, left and
Right.
right.
Yeah.
Smile ka nga, sir.
Yeah.
Yan. So,
Yeah.
nag-reduce naman, sir, no?
Yeah, definitely. Within that day, you made the procedure about 11 a.m. and then around 8 p.m.
You noticed the
Visible changes po. Visible
Yeah.
changes.
Yeah.
Almost gone. From around 10 to 20 lines, it's about 3 only by that night.
Ang dami naman palang lines nun, Dean. 20. Yeah, we did treatment of the so-called crow's feet for Dean. And we used Botulux, and I think I used 20 units. So both sides, 20 units already. And he was sharing with us that night, he was starting to see results already. And it was his first experience, first treatment with us. Alright? Okay. So in today's episode, our discussion will be on treatment for the below eye region. So let's ask Dean, what were the previous treatments you have done under the eye region?
Yeah. I've had dermal fillers before, twice already. I think 2 years ago and about a year ago for the second time. And I wasn't very happy with it. And so I was really hesitant to going for dermal fillers again. But then Dr. Contessa assured me that it's not only dermal fillers, but it has threads, and then my experience from the Botox injections, there's no bruising. So I definitely feel safe for having another procedure under the eye.
Yeah. So that dermal filler experience for below the eye, so you were not happy. So what made you unhappy about it?
Because the dermal filler was supposed to like reduce and fill in the eye bags. But then what happened? The eye bags turned into two. It doubled. So instead of it's supposed to be gone, there's a wave of 2 eye bags.
Oh, okay. Yeah, because we use dermal filler to primarily treat volume loss below the eye area. The sunken under eye, or the others naman, we treat dark under eye circles. So, to clear pigmentation. Okay, but we receive some experiences with dermal filler whereby they see a bulge below the eye. Or the others naman, yun nga, double eye bags already. Because below the eye region, if we review anatomy, there are several layers of tissues there. So, starting from the skin layer, and then there's this orbicularis oculi muscle beneath that, and there's also this fat pad under that. And even the fat pads, they have this upper superficial or the deeper fat pad. And it's the infraorbital fat compartment. And then beneath that, there's also a ligament separating the 2 sections, the infraorbital from the upper cheek region. So we have like an orbicularis ligament there also. And then the bony region. So you have to take into consideration those tissue anatomical layers. Now, in terms of placing the filler, you should inject it in the right anatomical layer. The others are not happy because they report also of a bluish discoloration from the filler, which we call
Tyndall effect of the dermal filler.
Exactly. The reason for that is the very superficial placement of the dermal filler.
Napataas siya.
Yeah, and it creates that reflection from the UV rays. Kaya parang nagkaka-bluish discoloration. So, when we inject dermal fillers in the under eye, we should inject it in the right anatomical plane to also prevent those problems of Tyndall, or also those bulges, double eye bags, sausage-shaped bulges, or nodule, or any protrusion. Because we wanted to correct the volume under the eye. We wanted to restore the volume, but you should give it the right result, right? Dapat yung outcome maganda.
Yes,
dapat even, at saka yung border ng eyelid and the upper cheek, dapat naging pantay or balance. Yung lid cheek junction should have been corrected also. And yung sunken part, you should have elevated it. Okay. Since Dean had already dermal fillers in the past, what we have recommended right now would be the use of protein threads or the PDO threads. And we've been doing these PDO threads under the eye for several years already, and we have a lot of good reports from it because the PDO threads would also stimulate collagen synthesis. These are absorbable threads. Okay, they're not permanent. But after they get absorbed, they will be replaced by new collagen fibers. So it's like re-strengthening your tissue structures or re-densifying your tissue structures. So yun yung longer-lasting effect niya, yung tissue collagenesis. And at the same time, it has rejuvenation effect. It lightens the skin. It brightens the skin. Yeah, it has all those benefits. Now, unlike with the hyaluronic filler, the filler attracts water. That's one thing we also review amongst doctors who are injecting fillers under the eye. We don't want to overcorrect also, because if you overcorrect, you put too much of the hyaluronic, like a week or 2 weeks later, since it will attract water, it can create that expansion leading to bulges. The others may not see it when they're not smiling, or the others only see the bulge when they smile.
Yes.
So, iba nga pag nagpapapicture daw, ayaw ko na nga mag-smile, Doc, kasi
Nagbabulge sila, Doc.
umaangat yung bulges. And another thing, bakit parang naging double eyelid or eye bag? Because in the upper layer, dito sa may lower eyelid, we have a prominence of the orbicularis oculi muscle. When you smile, nagko-contract yon. So, siya yung parang nagbabulge immediately doon sa lower eyelid.
Yes.
So, that's the muscle tissue, which you don't really remove, or of course, you don't surgically remove it. Otherwise, you can't close your eyes anymore. So, yung iba nga gusto nila may ganun. It's the so-called egyoshal or charming eyes or eye roll. In Korea, usong naman ngayon, nilalagyan ng filler yung lower eyelid mismo to create that charming look. Okay? Now, so yung upper layer na yun, where you have a contraction of the orbicularis oculi, some people have very active muscle. Some people have the so-called hyperkinetic, hyperdynamic muscle. So parang ang laki-laki ng bulge. And then when you inject a substance below nun, dito sa may orbit rim, yung mismong bony orbit, and then you put a filler. Kung sumobra, and then nag-attract pa ng water, so what's gonna happen?
Magbabulge
It
siya.
will bulge. So whenever he smiles,
So parang overcorrected siya, Doc.
may dalawa, yung muscle, magko-contract, nagbabulge, and yung
On top of
filler
it, the
na,
filler.
Yeah, so we wanted to, as much as possible, limit the amount of the dermal filler that we inject, because especially if that type of filler is so hydrophilic, kasi some fillers have different rheology or different chemical properties. You have to also check what kind of filler you use for the under eye, because this has different properties like high G prime, low G prime, so doctors know those proper chemical properties. So not all fillers will be best for the under eye. You have to choose the right kind of filler. For now, what we're gonna do for Din is correcting the parang bulge also. At the same time, treating the volume loss.
Yes.
Then we want also to firm the skin, tighten the skin, rejuvenate the skin. So what we're going to do is to use those PDO threads, which we will show to our televiewers sa pagbabalik ng CSA Medical Aesthetics. And we're back, mga ka-CSA. So we'll now show you the actual procedure for the under eye PDO threads. Okay? So we start with cleaning the area, disinfecting.
Yes.
Make sure that we sterilize the
area.
the working field. And then after that, we also apply the topical lidocaine cream. Kanina po, we did application right din yung dito, yung numbing cream. Then we left it for about half an hour to 45 minutes. And then in doing our PDO threads, we have to create our entry points. So we make the 5 entry points on the laterals, this side here. So actually, so the lateral canthus, like about a cm, 2.5 cm below that. And then so we make like initially 2 markings, and posterior to that another 3 markings. As easy as that. Okay, and then we have to again numb the area, the entry point. So the numbing will be injection of our lidocaine. So just a little bit of this. So usually we just inject on the entry points. So we have how many entry points? 5. So it's 2, and then 3rd, and then the 4th, and then the 5th. Okay. So after creating or injecting your lidocaine, we can now make our 5 entry points. You're okay, Din? So we're gonna make an entry point here. Okay, first one here, second one, and then a 3rd one, 4th one.
That's the last one, Doc.
Yes. We're going to proceed to the other side. So we're proceeding to the left side. And again, we have to inject lidocaine. So I have 5 entry points here. Okay, 1, 2, 3, 4, and 5. And there you go. And we're done with our PDO threads for sunken under eye or dark eye circles. Okay, so we have done the left side. Okay, we'll show the result when Silsei Medical Aesthetics return. And we're back, mga ka-CSA. So we're now going to show the result to Dean. But prior to that, let's have a review. Okay, we did insertions of PDO threads from the lateral orbital rim towards the medial orbital rim. So the anatomical layer, of course, you have to go on the between layer 4 and layer 5. So avoid the superficial layer for the threads not to be seen or visualized on the superficial area. Okay, so let's show the result to Dean. Ayan, ito na po ang mirror.
Maliwagang mirror.
Oh, wow.
Kamusta, sir? How's the procedure ba?
Yeah, I was relaxed the whole time.
Yeah.
I felt a little pressure on the left side, but then no pain and no pressure on the right side. None at all. At peace the whole time.
Pero kamusta yung lubog?
Very impressive, though.
Yes. You're happy?
Yeah. I don't want to put down the mirror.
The PDO threads actually are also volumizing threads. So if you have areas that are sunken or there's this volume loss, our PDO threads could help in restoring the volume loss. So it's also a good alternative to your filler injections below eye.
Yes.
Yan.
Wow.
Mas tsaka natural yung result. Okay. So since our entry points were just on the lateral area, so pinpoint ano lang, this one, entry points. Parang tiny ano lang, no, kagat ng bug yon. And then in a little while it's gonna go away. Then the blanch is just from the lidocaine that we have injected a while ago. So usually magki-clear naman yan, it's gonna go back to the normal color in a little while. Then just do ice compress. Then you can take some analgesics and also your vitamin C supplement. Okay. So for some of our patients, we give prophylaxis antibacterial.
Yes.
Okay. So yun lang. And then some people are asking after this, Doctora, am I not allowed to exercise or what food
Usually
should I avoid?
Yes, they're not allowed for the strenuous exercises.
Yes.
And of course, the hypoallergenic diet muna tayo.
Correct. Yeah.
Um,
But you can go to Subway, ah.
Yes.
Yeah. For how long po yung non-strenuous exercise?
Usually, less than a week.
Usually,
Okay
less
na
than a
kasi dito, ano lang naman eh. Yan, o, tingnan mo nga, parang wala nga siyang bruise eh.
To prevent also the inflammation, kasi it's ano yan eh, nagtusok tayo dyan eh.
Yeah.
Yes.
Can I wash my face with soap later or
Tonight,
tomorrow?
tonight, you can already wash your face. Basta cold water lang, and then your mild cleansers lang.
Yes.
Yan. Okay. Any additional input sa ating televiewers?
Well, I'm really happy, and then it looks really impressive. Sobrang nag-tight siya. And then I feel that I look younger, 2 years younger.
Wow.
And it's just minutes after the procedure. So I can wait after 1 month, 2 months, 3 months, just
Yeah.
like what you said.
Yeah.
After 3 months, it would get better.
Better,
So there's something better from this.
Correct, yeah.
I'm excited for that.
That's a wonderful thing with doing the PDO threads under the eye. In 3 months' time, there's this so-called neocollagenesis. And so you're further strengthening the tissues within. And of course, you can still make use of the dermal filler. Kasi there's also this discussion, like can you combine threads and fillers? While in my practice, I do also combination filler and threads. Okay, there are cases that I will just recommend threads will be okay na.
Yeah.
And some cases, filler will be okay na. But yun nga, you have to be assessed muna before we do any recommendations.
You have to evaluate the patient first, no? Kasi case-to-case basis po.
Exactly.
Tsaka yung mukha nila, iba-iba.
Right.
And also the degree of the weakening or the parang lalim or lubog ng under eye.
Yeah. Right now, I just see some contraction from the orbicularis oculi muscle. Later on, we're still gonna treat that with injection of your Botox. Okay. So, para talagang totally flat na. Wala na talaga yung eye bag. Okay. Smile nga. Ayan. So, yun lang. We'll just treat this orbicularis oculi with a micro Botox. Small dose. Very small dose lang ng ating Botox. Kasi we need the orbicularis oculi muscle to close the eyes also. So, we don't want to paralyze it. We just want to relax it a little bit. Yan. So, additional pa. So, Dean, do you have any further announcement?
Well, hi guys. You can follow me on my 2 social media handles. For Facebook and Twitter, it's at Dean Gomez. DENEGOMEZ. And then for Instagram, it's at Dinamita. Or you can just search Dean Gomez. You can find me in YouTube as well. You can search Dean Gomez. Yeah.
So, those who wanted to ask questions, kung single ka ba? Just a joke. No, some of our televiewers would also want to ask yung mga naging guest namin. How does it feel? Tapos nag-improve ba talaga? Yun. So, if you could also share with them those vital informations or answer their questions.
It will be my pleasure.
Yeah.
You can message me
So,
anytime.
if you have further questions, you may email us at csaskinclinic@yahoo.com or our FB page, CSA Derm Centre, or Instagram, CSA Derm Centre. Our clinic is located at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. So, yan. Salamat. Yan. So, ang iba naming mga topics, we have our YouTube videos. Ang channel namin, Contessa Salvador. And paki-click na rin yung, click. Paki-click ang like and subscribe and notification bell.
Yes.
Yeah. Iba na talagang ngayon, social media. Okay, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.